So my name is Dr. Nicole Brown. I'm the one of the founders and the Chief Health Officer at Strong Children Wellness Medical Group. And I've been a pediatrician for the past 15 years. And this flu or RSV season has been a real challenge. It's probably among the worst flu seasons and RSV seasons I've ever seen. Um, in part, I think, and we're still trying to determine why, but because kids are fully back to school, most kids are unmasked in school. These viruses haven't gone anywhere. They've always been here, especially during the fall and winter seasons, but they have a real opportunity to spread now that masks are off. And so we have been educating our parents, the families we see, the children we see, about ways to stay safe, and about the symptoms that they need to look out for, especially when it comes to RSV and the flu. Many people are very now well aware of COVID, and are educated about COVID and how it presents. It's sometimes very hard to make a distinction between the three viruses, but RSV has a particular predilection for infants and toddlers and young children, and it can make them very sick. So as we all move into the holidays, Christmas, there are a lot of gatherings, travel, and as school sort of winds down for the semester, we're really doing more and more education about how to keep children safe. If you do have a chronic condition like severe asthma, or your immune system is suppressed for any number of reasons, I am still strongly recommending that children and family members around those kids stay masked, especially if you're in a large gathering or an indoor setting, to protect yourself not only from COVID, but also from the flu and from RSV. If you haven't gotten your flu shot yet, if you haven't gotten your COVID vaccine or a booster, I am still strongly recommending everybody to get it because it's one of the best forms of protection. Even if you do get sick with these illnesses, the vaccine helps to prevent severe illness. So we are giving our full recommendation to all parents on the fence about vaccinating their children or themselves. Really get those vaccines because it will help to protect you against severe illness from these three viruses that have been circulating.
Thank you so much, Dr. Brown. We care about health and wellness at the Child Center of NY. We know Strong Children Wellness does, and it's just wonderful that I had a chance to run into you and hear you say it's the worst you've ever seen in terms of these infection rates with the children. Just at the time when people want to take their masks down, we're wondering, this means that we may be putting ourselves at risk for some of our, what I call old-fashioned, illnesses and diseases that we're used to in the wintertime, but we don't have to get used to. We can use these new measures that COVID brought to our attention: social distancing, hand washing, and wearing that mask. So thank you so much, Dr. Brown. We appreciate you keeping us healthy and well at the Child Center of NY.
Oh, thank you so much. I'm so glad we ran into each other.
So am
Anytime.
I. Take care. Bye-bye.